Honourable Chairperson, the ACDP notes yesterday's approval of the National Health Insurance Bill by Cabinet, which the President in his State of the Nation address said aims to reduce inequality and improve access to public health and private health facilities. We have one common enemy in this room, and that is indifference. Indifference to the plight of the poor and the vulnerable. Indifference is at the heart of a man who died outside a Western Cape hospital, provincial hospital, after waiting to be treated since the early hours of the morning. Indifference when a nurse cringes to perform basic observations on a patient because of the state of his appearance. Indifference when a young mother, inexperienced, scared, and overwhelmed after being up all night with a sick infant, is not addressed in a mother tongue, but made to feel foolish and unintelligent because a primary care nurse could not be bothered to take the time to listen or to call an interpreter. We have to ensure that we foster a caring and compassionate health sector, as set out in the White Paper on Health. The target set out by the Department of 50% satisfaction at primary healthcare facilities does not reflect that aim. It is sadly far from being realized. This said, we can learn from the example of health facilities, where I have experienced firsthand the commitment to best practice. The example should be lauded and emulated throughout our nation. Pockets of best practice is being displayed in some facilities. And a facility that I visited in Ravensmead, I met a young woman, wide-eyed, passionate about the health profession, a third-generation health professional, and she impressed me with her enthusiasm. We need to develop a retention strategy for our doctors, pharmacists, nurses, and we need to make sure that they are safe. We cannot afford to continue to bleed talented, passionate health professionals. Effective intersectoral collaboration is cited by researchers as key to address social determinants. Honourable Minister, we as the ACDP are calling on this department, together with the Ministries of Social Development and Human Settlements, to address with urgency the need for special housing. We have been urging the government for years to respond adequately to the plight of our most vulnerable people. This includes those suffering from mental illness, trauma, or abuse, and the elderly. Families are suffering under the weight and the trauma of caring for those who are mentally disturbed. Our current facilities are limited, and individuals who can be restored to health deteriorates even further due to a lack of treatment and care. That includes special needs housing. Mental illness has increased due to drug addiction and the destructive effects of drugs such as tik and unga. We implore the Minister to support this policy. It has been waiting for the last 20 years. Care cannot be siloed. Lastly, I wish to quote Florence Nightingale, who said, and I quote, "It may seem a strange principle to enunciate as the very first requirement in a hospital that it should do the sick no harm," close quote. Our hospitals should not be mortuaries, but places of healing. Thus, we appreciate the comments, and we appreciate what Dr. Dlomoy has said here. South Africans are waiting for this house, for all of us, to work together to make their lives better. And I thank you.
Thank you, Honourable Member.